What I was most worried about was losing the hearing. I felt like these building blocks that had been laid in my life all this time were being pulled away from me.
Hearing loss is an invisible disability. People live in silence. Currently, there are 1.5 billion people with hearing loss. That's 1 out of 6 individuals. Sensorineural hearing loss is the most common type of hearing loss, and it typically originates from the inner ear. The first step that we do when we encounter a patient with hearing loss is listen to their story.
I thought, gosh, I must be an old man. I'm 55 and my father just got hearing aids and he's 85.
Treatment options for sensorineural hearing loss are currently limited to primarily 2 types of devices. Hearing aids typically work for people with mild hearing loss, and cochlear implants are reserved for people with severe to profound hearing loss.
Hearing aids got me by pretty well until the hearing started to deteriorate. My wife would have to look for the restaurant review that says it's not noisy.
When I saw Dr. Stankovic and team, hope really came alive.
The way we perform cochlear implant surgery is that we insert the device through a natural opening into the inner ear, which is called the round window membrane, and then insert it very gently so that it goes along the length of the cochlea.
The results so far, nothing less than astounding. I mean, I couldn't not recommend this to anyone that has the degree of hearing loss that I had.
Implants are the only technology that can not only give you better access to sound, but better clarity. A lot of what we do is not only helping people hear better through technology, but also talking about listening strategies, also educating people on ways to live in the world with hearing loss.
They sort of illuminated the possibilities of what could be recaptured in this life of mine. Feeling seen, heard, and received, it was phenomenal.
With the implant, I can understand my daughter much easier. It's life-changing.
At Stanford Medicine, we can blend this compassionate, skilled, personalized patient care with cutting-edge research. Our hope for the future is to enable options and cures for hearing loss, or at the very least, better treatment options. Because hearing is such an essential sense for human connectedness.